Brain injuries. So we've talked about concussions, but there's other types of injuries to the brain. So brain tissue cannot repair itself. However, we know we don't use all of our brain tissue, so we can sometimes create new neural pathways kind of around the damaged portion of the brain to prevent any permanent disability. Any level of tissue loss is going to have permanent disability, but sometimes you can work around it, kind of literally put a roadblock and figure out a different pathway. Other times you can't. It depends on the severity. So, traumatic brain injury severity. So, we've talked about mild TBI, i.e. a concussion. So, a mild TBI is considered when you only lose consciousness only 10% of the time. So, like a mild head injury. A moderate TBI, you have loss of consciousness or a coma for less than 24 hours. A severe TBI is a coma for greater than 24 hours. That's basically how you keep track of what they are. So when we talk about traumatic brain injuries, or TBIs, we're talking about concussions, which we've already gone in depth on, contusions, which remember, contusion is a bruise, and remember, a bruise is a small hemorrhage, and this can be within the cortex of the brain stem, or the cerebellum. It can be at any point. And it's usually from an impact. So basically the head hits an immovable object, and it hits the side of the skull. It's a bruise to the brain. Remember, we talked about that is not a concussion. Subdermal or subarachnoid hemorrhage. These are majority from blunt force trauma and a disruption of the blood vessels that result in bleeding and swelling within the cranium. Subdural or subarachnoid hemorrhage, it depends on location. There's also countercoup injuries, which is where you hit your head on one side and you have damage on the opposite side. So intracranial injury, so epidural hematoma. So this is bleeding between the skull and the dura mater. So you notice in that image, it's pressing down on the brain and increasing the pressure, and it's in between the skull and the outside of the brain. And it traditionally is an arterial bleeding, and if it's arterial, it's a quick bleed. It's a quick damaging thing. It's a blow to the head that results in the cause or tear of those arteries. They're all embedded in the bony grooves, and so if they're damaged, they bleed. And you can have damage here within minutes to few hours. And once this happens, loss of consciousness worsens. And this is when you hear of the horror stories of they went to sleep and they didn't wake up. So subdermal hematomas, notice it's a little bit deeper. So this is between the brain and the dura mater. The other one's the dura mater and the skull. This is almost within the brain a little bit more. This traditionally is a venous bleeding, so it develops over slowly. This is more common. It happens more frequently comparatively to epidural hematomas. And this is from an acceleration or deceleration. So basically that shake or stopping, think of the whiplash options that happens within the brain. And they tear the vessels that are the bridge between the dura mater and the brain. And most of the time, it does not cause any unconsciousness. So, intracranial hematomas has pooling of the blood for damaged blood vessels within the brain. So there's just imaging of what it would look like. So you see all where the white is, that's the blood. Now, CVAs, or cerebrovascular accidents. So in essence, this is a loss of blood flow, oxygen, to the brain. So ischemia is lack of blood or supply to the organ. Thrombosis is when there's a blood clot that impedes it, so there's a stoppage, like a blood clot. An embolism is a word for a clump of material. Basically, something breaks off and wedges itself. So not a blood clot, but it's still a piece of plaque maybe, or anything else that ended up in the bloodstream. Arteriosclerosis is the hardening and thickening of these arteries and the walls, and so it narrows the passageway. And stroke is when the blood flow is completely cut off. So a CVA is another term for a stroke in common language. However, there's different causes and different levels of a stroke. There's a severe stroke or a mild stroke, and it can be caused by different things. Was it a blood clot, an embolism, or arteriosclerosis? There's also degenerative brain diseases. Alzheimer's, Downs, Parkinson's, Huntington's, MS, epilepsy, and schizophrenia. So these are all different brain diseases. So as we know, Alzheimer's is a more progressive mental deterioration caused by deterioration of the actual brain. So an Alzheimer's brain legitimately has less neurons and also has different damages to the brain. You can see here, someone with Alzheimer's has these different plaque buildup, and so it causes issues with communication, and also notice how the neurons look differently. So Down syndrome is a congenital disorder. It's a chromosomal defect. Parkinson's is a tremor disease that causes tremors, rigidity, and slowness of moving, impaired balance. This is a progressive disease and traditionally in an older population. It does sometimes mirror Alzheimer's, but Parkinson's, the difference is traditionally Alzheimer's doesn't have tremors where Parkinson's does. Huntington's is an inherited disorder, and it causes death of brain cells and eventually will lead to death. MS is a progressive disease. It involves damaging of the sheaths around the nerve cell, and because those are damaged in the brain and spinal cord, it causes an impairment in speech and muscle coordination, and eventually unable to breathe, unable to function, and therefore causes death. Epilepsy is an abnormal brain disease by the electrical activity within the brain, and because basically it's like almost like a bad circuit, it causes seizures. Schizophrenia is a mental disorder, but honestly, schizophrenia, there is a breakdown with the relation between thoughts and emotions and behavior, and it is a disease, not necessarily fully within someone's brain. You can be genetically predisposed to it as well. So if we saw this picture, the changes in the neurons versus Alzheimer's versus a normal brain. And then here is a picture, you can see how it lights up as someone's brain that has a normal brain versus Alzheimer's versus Parkinson's versus normal. See how it completely looks different? That's how they diagnose these different diseases.